So the next group of drugs that we'll be discussing are anti-inflammatory drugs, which are very commonly used in ophthalmology. There are mainly two groups of drugs under that. The first one is corticosteroids. The second one is non-steroidal anti-inflammatory drugs. Corticosteroids, again, you have topical and systemic. The common topical corticosteroids which are used are fluoromethalone, cloteprednol, remixolone, prednisolone, dexamethasone, and hydrocortisone. So, what is the mechanism of action of corticosteroids? It inhibits arachidonic acid release from phospholipids by inhibiting the enzyme phospholipase A2. What are the uses of corticosteroids in ophthalmology? They are one of the most common drugs which are used post-operatively. They are usually given as a combination with an antibiotic. The other indications are anti-uveitis, severe allergic conjunctivitis, vernal keratoconjunctivitis, prevention and suppression of corneal graft rejection, episcleritis, and scleritis. The adverse effects of topical corticosteroids include susceptibility to infection, glaucoma, cataract, scleral melting, and occasionally skin atrophy also. The systemic corticosteroids are prednisolone and cortisone. So the indications are posterior uveitis, optic neuritis, temporal arteritis with anti-ischemic optic neuropathy. So these are all indications for systemic corticosteroids. What are the adverse effects of systemic steroids? Posterior subcapsular cataract. This is more commonly seen with systemic steroids. It can also cause glaucoma, which is more commonly seen with topical steroids, and it can also cause central serous retinopathy. The systemic side effects include the suppression of the pituitary adrenal axis, hyperglycemia, osteoporosis, peptic ulcer, and psychosis. So these are the list of adverse effects of corticosteroids, systemic ones. Next group of drug is a non-steroidal anti-inflammatory drug. So in ophthalmology, the common drugs which are used are ketorolac and flurbiprofen. How does it act? It acts by inactivation of cyclooxygenase enzyme. It is used post-operatively again, just like the corticosteroids. It's also used in mild allergic conjunctivitis, episcleritis, mild uveitis, cystoid macular edema, and is also used pre-operatively to prevent meiosis during cataract surgery. So it has the use prior to surgery as well as post-surgery. It can cause some stinging sensation while it is being instilled in the eye. So that is one of the common side effects. Next is anti-allergic drugs which are used. They include antihistaminics like phenyramine and levocabastin, decongestants like nafazoline and phenylephrine, mast cell stabilizers like sodium cromolyn, rhodoxamide, pemerolast, nidocromil, and olopatadine. NSAIDs are also a form of anti-allergic drug, so they include flurbiprofen and ketorolac. Steroids like fluoromethalone and prednisolone are also used as anti-allergic agents. So again, it depends upon the physician's choice and the amount of allergy that the patient has. We can use any one of these medications. Next is anti-VEGF agents, which are these vascular endothelial growth factors are responsible for neovascularization disorders. Basically, new vessels are formed on the retina, which can lead to bleeding disorders inside the retina. So our aim is to see to it that these new vessels are not going to form. So we can use agents like the anti-VEGF agents to prevent neovascularization. They have got specific indications which are they are used in wet ARMD. ARMD is age-related macular degeneration. It's of two types. So dry one and the wet one. The wet ARMD is said to cause a membrane which is called as a choroidal neovascular membrane. So this neovascular membrane Once it develops, it can be controlled by using anti-VEGF agents. It can also be used in diabetic macular edema and also used in neovascular glaucoma in central retinal vein occlusion. So there are three common anti-VEGF agents which are used. They include ranibizumab, which has a trade name of Lucentis, pegaptenib, which is marketed as Macugen, and bevacizumab, which is marketed as Avastin. So these are the common anti-VEGF agents which are used. There are a wide variety of antibiotics which can be used in ophthalmology. But the most common ones which are used are fluoroquinolones. Apart from that, even tetracyclines, topramycin are also used. What are the indications for antibiotics in ophthalmology? They are used topically in prophylaxis and treatment of ocular bacterial infection. They're also used orally for the treatment of preseptal cellulitis. The most common drug is amoxiclav, which is a combination of amoxicillin with clavulanic acid. They are used intravenously for the treatment of orbital cellulitis, like gentamicin, cephalosporin, or vancomycin. They can be injected intravitreal for the treatment of endophthalmitis. They are also used in trachoma. The drugs which are used are topical and systemic tetracycline, erythromycin or azithromycin. Corneal ulcers are also treated by using fortified penicillins, cephalosporins, aminoglycosides, vancomycin, and fluoroquinolones. Conjunctivitis is usually said to be self-limiting, but we can also use fluoroquinolones or chloramphenicol in those cases. So these are the wide variety of indications of antibiotics. Antifungals are usually used in fungal keratitis and fungal endophthalmitis. There are again different groups of drugs here. The first group is polyenes. They damage a cell membrane of susceptible fungi by binding to the sterol group. So under this we have amphotericin B, natamycin, and nystatin. The next group of drug is imidazole. It increases fungal cell membrane permeability. Under that we have miconazole and ketoconazole. The last drug is flucytosine, which acts by inhibiting DNA synthesis. Amongst these, it is nystatin, natamycin, and ketoconazole are the commonest drugs which are used, and amphotericin is most commonly given intravenous. So these are four drugs which are commonly used in ophthalmology. Next is antivirals. Amongst these, the most common antiviral drug is acyclovir, which is used in herpetic keratitis. The other drug is ganciclovir, which is used intravenously for CMV or cytomegalovirus retinitis. And trifluridine is also used for herpetic keratitis and herpetic iritis. It is said to have more corneal penetration. The commonest drugs which are used are acyclovir and ganciclovir.